Welcome to the Reach Mental Health series, and this is the second video in our series on ASD. I'm Chitra Paul. I'm a parent and I run a couple of parent support groups on various social media platforms, and I'm also a trained special educator, and I'm in conversation with Dr. Yashaswini from the Reach Clinic. Thank you, doctor, for being here. And I'll just start off with the questions. Doctor, do behavioral issues worsen when the child with ASD reaches adolescence? What is your...
In general, during adolescence, behavioral issues increase in any child for that matter, right? Because puberty and adolescence brings special issues, some new issues which are appropriate to the developmental phase. So yes, the behavioral issues actually exaggerate in children with autism spectrum during adolescent phase. Okay. And the kind of behavioral issues are, you see a lot more aggression rates are definitely higher during the adolescent phase in children within the spectrum. Self-harm rates can go up. There's a lot more anxiety that these children exhibit during adolescence, and sometimes they become more rigid. The rigidity could increase, they could become more stubborn. So some of the behaviors are increasing like in any other teenager. So sometimes you need to understand what is ASD and what is the typical teenage behavior that you're seeing as well. So because they're becoming more stubborn, there could be more non-compliant and more resistance you could be seeing from them. And they want some independence, they don't want to follow, or they don't want to be corrected like any other teenager. So some of these typical teenage behavioral issues would be there, but in ASD, definitely aggression, self-harm, mood instability, anxiety, mood swings, some of these things have to be looked for, because sometimes all these rates are higher in children with spectrum.
So what about issues of sexuality, like when children hit puberty? Those become a focus. So are they should these be taught to children with ASD? What is your...
See, this is an area where any child requires education, right? So you take a typically growing child, issues of sexuality are taught to them, right? You have life skills education, yes, and education in all these areas, and even in a typical child. So even in ASD children, they need to be educated about these issues. So they are like any other teenager with ASD. We can't say just because they're in the ASD group they do not require any sexuality education. So these children also require a sexuality education. So that's what I would say.
And what age do you think, doctor, this education needs to start? Like parents need to start working on this kind of an education with children?
I think let me answer this question this way. Let's break it down into some steps. Okay. So when we talk about sexuality education, what are the some of the steps, yes, that you do? It starts with dressing, right? Okay. So how do you teach a typically growing child dressing? You don't wait to teach a typically growing child about how to dress, what are the boundaries, how do you come out of the bathroom after taking a shower. You start that pretty early in typically growing children. Same thing has to be done with children with ASD. Just because they're having ASD doesn't mean that you wait till 10 and 12 and then start teaching, because it gets very difficult if you do that. So the dressing has to be taught. And the other most important thing is the touch, sense of touch. Again, think of a typically growing child. You start these things very early, right? By 6, 7, you start slowly integrating in the form of a normal routine, okay, during the process of their daily routine activities at home. So the same thing. However, the only difference is here in ASD we're talking about what language should be used. Okay. So, and again, because each child within the ASD spectrum is very different, you need to use the language that is applicable to the child's development and also cognitive development, because each child is different. What is their level of understanding? So a parent can't talk to as if you're talking to a typical child. So, and again, some of these children need to be told, visually they can learn. Through social stories you can teach them. So some of the children are obsessed with computers, so you could do some activity based teaching, or let's say they're obsessed with the Chota Bheem character. So utilize those things and weave it in the form of a social story, that this is appropriate touch, this is the boundary. So then that is the way that you can teach them.
And you feel parents can take the lead in doing this, or do they need to approach a professional?
See, where is the child? Child is in the home context, right? So you have a lot of learning that happens during the process of day-to-day routine activities at home. Showering, bathing, dressing, how to come out, how grooming. Where do you stand, when your sibling is older, right? What is the boundary that you need to maintain? So a lot of learning can be done during the routine activities. So an office-based learning has to be generalized. So I would say parents come first. I would say the home environment comes first. Then a school environment, because these children are in the special education setup, most of them. So the teachers do have a lot of opportunity to teach those. And third thing that I want to emphasize on is, some of these children, because of their sensory needs, they want to hug, they want to touch children. So as they're growing into teenage, you need to teach them who are, like you were saying, the inner circle, whom are the people that you can hug. So they need to be taught who are the inner circle, who are the outer circle, the boundaries that need to be maintained.
There are parents who actually teach their children not to hug even parents. So that's why, is that appropriate?
Why they should hug parents? I don't see any problem with that. They should see, because maybe their worry is, okay, I need to stop at all levels.
So do you feel that could also lead to more harm the other way?
The rationale for them is all or none. It's not like that. We should do this inner circle. Who are this, where could be this behavior be done? And then the outer circle where it can't be done. Let me take some examples from my clinical experience. Recently, I'm, one teenage boy within the spectrum. Now suddenly he got into taking pictures. Now he has a cell phone. Now he wants pictures of everyone. So he said, "Can I take your picture?" And then then he was saying, "Okay, I want you to stand this way. I want you to keep your hand this way." All of that. So now I had to educate this child. Okay, you need to ask permission first, because this child wants to take pictures. So you need to take permission. And you can't take permission from random people. You can't go on the road and say, "Okay, can I take your picture?" So this child, we had to teach him about taking permission, whom to ask, and even if the person agrees, how to put it. You can't put a lot of rigid opinions. The person needs to, you need to wait for how the person is comfortable and what is he saying. So of course this is a high functioning child who can speak, but as I said, we need to take these kind of examples and teach them when to do what.
So the sexuality education and the social interaction skills, everything, they're all interlinked and they need to be worked on.
Yes,
Thank you.
Of course.
So could you tell us a little about the other conditions that you see associated with autism?
Before that one, I do want to touch upon another point. There's also inappropriate touch and inappropriate behavior some of these children get into. So we are calling inappropriate, some of the behaviors are normal adolescent hormonal development. So behaviors related to typical pubertal hormonal urges, right? So but these children do not know how to exhibit it, when to exhibit it, where to exhibit it. So they do not have this inhibitory control. So what happens is they could be stimulating themselves, they could be, sometimes the stimulation could be a part of sensory issue, sometimes it could be a part of a typical pubertal development. So here the parent needs to think, what is it? If something is suddenly increasing, probably they need to step back and think, how do I help this child? So if the parents might be having an older child and may not have had problems because the older typically growing child knew how to draw the boundaries. But this child need to be educated on where you can do it, what are the safe places. So they need to be taught about those things.
So parents need to really do this and not ignore it.
You can't ignore. If you ignore, what happens is it's going to come out at school or in public places. So you need to teach them about this, the appropriate behaviors. in a safe manner. Yes.
Thank you, Doctor. So we'll go back to the
Yes.
other question I asked about the other conditions associated with ASD.
So when we talk about other conditions, we call them as co-morbidities, coexisting conditions that you could see in a child with autism spectrum disorders. So let's start with neurological conditions. The most common neurological conditions that you see in children in the autism spectrum is the seizures.
Okay.
There's a high incidence of seizures in children within the spectrum, and a lot of so the rates of seizures would be anywhere between 12% to 26%. So as the children grow into teenage years, they could increase up to 26%. And then there's, some children also have chronic epilepsy as well. Sleep disorders is very, very common in children in the autism spectrum. I mean, you find it across from young children to adolescents to even adults with autism. So because their sleep-wake cycle could be, could be disturbed, right? So those would be the most common neurological symptoms. And the most common other conditions that we would see is the GI, gastrointestinal problems in children. Very, very common in children within the spectrum. So some of them could have diarrhea or constipation. Allergic reactions are very, very common in children within the spectrum. Allergens to foods, particular kind of foods, gastritis, reflex problems are very common, and gluten sensitivity, very, very common in children within the spectrum. That's the reason why these children have to be tested for allergens, and metabolic profile has to be obtained. So and the other thing is, of course, is the psychiatric comorbidities. Intellectual developmental disorder, previously it used to be called mental retardation. So a lot of children, 1/3 of the children within the spectrum have intellectual disability, or more than that in fact. So according to the current studies, a lot of them have the intellectual problems. Cognitive deficits is what I mean in simpler terms. Cognitive deficits. So, and then ADHD is very, very common in children with ASD, because anywhere between 40 to 50%. Learning difficulties, lot of anxiety problems. OCD is one of the very common condition that we see as a psychiatric comorbidity.
How about
aggression, self-injurious behaviors?
How about things like dyspraxia and dysgraphia, and all these also
are coming as, you see them in younger children, and they might continue as well. So developmentally dyspraxias and all of these things. Hearing problems also.
Okay.
Yeah.
And I just wanted to go back to the comorbidities, the associated conditions, the GI conditions. So do you think parents should follow up on these even before, like right from the beginning, if they feel there is something different, like the child is suffering and there are no visible symptoms also, and they approach a gastrointestinal physician and go about it?
See, a lot of these children, when we talk about gastrointestinal symptoms, they start exhibiting these from a very young age.
Okay.
So what happens in children with autism spectrum is, because a lot of them have language impairments, social skill impairments, and communication delays. So addressing their pain or discomfort becomes very difficult. So a lot of times the medical problems are unaddressed in these children unless the child has severe pain and has severe discomfort. And most of these, the underlying pain, it could be a tooth problem, it could be an impending viral fever. All of this come up in the form of behaviors. So we have to address these conditions, and the GI symptoms, the stomach upsets, definitely we need to look into these underlying medical problems. If anything has to be addressed separately, and of course under the guidance of professionals. Yes.
Thank you.
To be on the safe side. Yes. Because because sometimes you see home remedies being done. That's all good, but again at the same time you don't want to overstep and do things which are not good for the child, because there are some children who are on gluten-free diets and their tummy problems have vanished after being on gluten-free diets. But at the same time we need to ensure that the child is not malnourished, because a lot of children can have protein deficiencies and vitamin deficiencies in this group if they are restricted from a lot of food. So we need to be careful in that area. And the other thing is excessive vitamins and
excessive supplements that So even those need to be taken under supervision.
Yes, because excessive vitamin, mega doses of vitamins can cause toxicity as well.
Okay.
So all of this, if at all is being done, needs to be done under supervision of professionals. Yes.
Thank you. And what about medications? Do you think medications help in the management of ASD?
Medications is a very, very important aspect of management of ASD. Of course, it's not a major part, but definitely in taking care of them, especially during adolescent phase. Because when we talk about, severe anxiety, severe obsessions, or depression, or mood instability, or severe aggression, the child is hitting the parent, throwing things. And I've had cases where the parents were told to vacate the house because the child was not sleeping, howling all night, very aggressive. So we need to help the caretakers as well. So medications, there are some medications which are approved by FDA, Federal Drug Agency, by the US, and used all over the world. So there are enough studies in some some of the medications which are approved to use for behavioral management in children with ASD. And I think we definitely need to use them to make to help these children settle down, and because they are disturbed as well. I see some children who haven't slept for 3 to 4 days. They're continuously shouting, continuously screaming. There's no sleep for the child, there's no sleep for the parent. And the school is telling them, do not send the child. So the father is unable to go to work because mom is not able to manage them alone. We need to help these families in whatever way we could do.
So medications need to be considered.
Considered as and when indicated, and of course we need to do proper medication management, proper follow-up. But again, we also, any clinician like me would run into the problem, they start the medication, we do not know whether it helped, and lot of parents would, I would hear from somebody else, that child got a side effect, so do you think my child will get a side effect? So we have to think of each child needs an individual centered approach in order to manage children with autism. So whatever works for one child may not work for the other child.
Thank you. And currently there's a lot of research happening in the field of ASD.
Yeah.
So could you just enlighten us about what some of the reasons?
See, the research is happening, the research has been going on in the last couple of decades, I think, but it's definitely increasing more towards the genetic markers.
Okay.
Because there are hundreds of genes identified. So the earlier genes were, they were talking about, the memo gene and shank gene and all of that. But now it is coming down to genetic gene editing. There's a lot of research going on to identify what are these genes, and there's a lot of research going on in terms of the radial genes. There's a lot of scaffolding of the glial cells that happens. Well, that's one area of research which is really progressing at a high rate. To see, because basically the understanding of the scientific community is in what we are understanding is the cortical development, cortex of the brain, the frontal cortex of the brain, which is the process of organizing during the first 6 years of development. So when the brain is organizing, there's a lot of communication that is happening. So if this communication is not happening properly, or if this organization of the cells is not happening properly, then you have this social deficits, you have language impairments. So the most of the research is going on, what are the cells involved in this organizing, why are some of the genes, these genetic mutations happening, and that is causing the disorganization of the brain. So a lot of research is going in that area. And the second area of research is in the imaging. What are the structural abnormalities? How is the brain looking differently? What is the blood flow in certain regions? So there's research going on in that area, and major research is also going on in terms of what are the environmental causes. Why is maybe in certain areas, geographical areas, are we seeing a rise in autism, or are we diagnosing autism more? So the environmental studies are also at a high rate as of now.
And any of these have been developed into some kind of therapy or intervention for the children with autism? Are they available as interventions, or it's just in the research stage?
See, like I was telling you, basically the research translates into clinical
Yeah.
implications, right? Like so as you know, there's a lot of research going on in terms of stimulating infant stimulation.
Yeah.
So that has to go on into practice as well. So that's the reason why when we talk about very young babies, infants, you're talking about talking to them. Infant stimulation also requires parent guidance.
Yeah.
You know, how do you stimulate a child? Not through the gadgets, more about vocal stimulating. So this actually is coming a lot of implication at a very early stage of development.
Okay.
Right?
Yeah.
So when the child is picking up these milestones, how to stimulate this child, this child. So a lot of programs also are centered towards parent education, parent training.
Yeah. Okay. And things like I've heard about stem cell therapy. So are these actually?
See, stem cell therapy is again an ongoing research, but they're not falling under evidence-based approach as of yet. So so including chelation therapy, hyperbaric oxygen, including even diets. All these are not necessarily falling under evidence-based. So maybe a lot more has to be done before they come under evidence-based. Right now, the evidence-based approaches still remain under the behavioral training programs, ABA, speech, occupational therapy, parent training, infant stimulation.
So you would still tell parents to be careful and think twice before going in for anything like this.
Yes, see, because as a parent, they want to try different things. You could try different things, definitely, but something which is very, very, very expensive, parents should think twice and not stop the traditional treatments which are having a lot more evidence-based as per the scientists and researchers.
Okay. Thank you, doctor. So I would next like to ask you about, do you think there is a need for parents to educate their greater families once a diagnosis of autism is given?
Extended families.
Yeah, extended families. So do you think that parents need to educate their families once they get a diagnosis of autism for their child, or they need to just...
This is a very good question, because this actually opens up a lot of questions. Okay, now what I am understanding about autism diagnosis is it can be easy to give a diagnosis of autism, but the diagnosis should be a diagnosis of empathy. I think it's very, very important. I think any disability diagnosis, any neurodevelopmental diagnosis, I think the diagnosis includes the empathy factor. It's not easy to give this news to young parents, coming with a lot of hope, wanting to hear from a clinician. The child will outgrow of it. It's just a 2 months thing. It's not something that you should be worried about. They want to hear this. And what happens when we are doing a diagnosis is we need to take care of the parent first, more than the child. So actually, the first time when any clinician, when any of us, we see the child, we're always focusing on the parent. And a lot of times because we're looking at the mom, how is she taking it? What is her understanding? Looking at the dad. Dad has already collected information, Google information, already spoke to the colleagues. So you're actually looking at two people who are the pillars for this child. So what happens is, in clinical practice, for all clinicians like me, we can't address everything in the first session. So first session is actually for the parents. What is their understanding? What are their questions? Where are they in the process of diagnosis? Diagnosis is a process. Diagnostic evaluation is a process. It can start with one. But unfortunately, the parent doesn't want to go through the whole process. Tell me if my child is in the spectrum or not. But even when we have put on that question, I think it has to be an empathetic diagnostic evaluation, which of course all psychiatrists follow in the field. That is one. And second thing is, no matter how much careful we are, of course we have to deal with the emotions of the mother and the father. And a lot of mothers need help. I think a lot of these diagnoses require parental counseling as a follow-up.
I was just going to ask you, how important is parental counseling?
It's very important, but I should also admit that it's not happening as much as we want. It's not happening. The reason is, once we say the diagnosis, then the parent immediately jumps into, okay, tell me the therapist, tell me the programs, and we are in a rush to get the child to the interventions, but we are ignoring the parent. And what happens is, when I see the child after 6 months, 4 months, the mom is depressed. The mom has developed a lot of sleep problems herself and a lot of anxiety. And we're always talking about the child, and we're not able to give the mother this help. But there are different reasons to it, because one is the child takes a lot of time. The child needs to be referred to all these therapies. The dad is the primary breadwinner. Dad has to go to work. There's not enough support system, and again, taking care of the mom does not have time, availability, affordability. Mom is already spending to all these therapies. So there are a lot of questions to be answered in this area, and I think parent support group, you're leading a parent support group, you're doing wonderful work. And I think as a clinician, I should also say that I do want to contribute something in this parenting area, because I think parents are the ones who need a lot more support.
So you would also tell parents that they need to take care of themselves also?
The First, what would you tell if a mom is carrying a 9-month-old child or a 1.5-year-old child, and the mom is looking very sad, depressed, not eating, and sometimes immediate effects of the diagnosis are there. I heard some messages. In fact, I have seen some messages where people, my own patients have sent me, ma'am, after meeting you for the first time, for the last 3 weeks, I'm not able to sleep. And it's so disheartening. You want to help this family. So there, in those situations, I didn't do anything great by giving the diagnosis. It's a bigger obligation for me to help this mother, right? In fact, a lot of times that takes a longer time. So in some situations, we need to stabilize the mom before we go further. Mom or the dad, for that matter.
Connected to that, how important do you think is a parent training program? After the diagnosis, do you think that parents need to undergo a parent training program?
Parent training program is very important at any level, right? Whether it is parent counseling, parent support, parent training in the form of stimulating infant stimulation, parent training in terms of understanding the symptoms, parent training in terms of behavior modification, parent training in terms of communication development, parent training when it comes to ABA methods, parents.
Immediately after the diagnosis, do you think a parents should be asked to undergo a parent training program to help them understand the diagnosis and how to go forward?
Here I would answer this question based on the understanding of the parent themselves. There are a lot of parents in a typical private clinic. There are a lot of parents who already have seen 4 people, 5 people. I could be a 7th consultant in the game. So they are seeing, okay, tell me if the diagnosis is right or not. So we have to look at what is the parent looking for. Where is the parent's understanding in the process? So I think again, this has to be a family-centered approach in such situations. So if there is no understanding at all, I do not know what this is, then we definitely have to go to the whole 9 yards. If a parent already knows, a parent is looking at certain things, then we start from there.
Thank you, doctor. So, inclusion is talked about quite a lot. So, in your opinion, do you think
inclusion
in schools? So, in your opinion, do you think all children with autism, do they need to be put into an inclusive mainstream setting, or do you need to also look at special settings?
Inclusion as a concept is a wonderful concept. But I want to answer this from a very practical aspect. Inclusion does not necessarily mean physical inclusion. So you can physically take the child and include this child with autism spectrum with 30 children in the class without catering to the needs of the child. without understanding that this child is unable to do anything in the classroom, unable to understand. The teachers are overworked, they need to deliver the syllabus at a different pace.
Okay.
They do not have time to get down to the level of the child. So this is just a physical inclusion.
Okay.
This is not an inclusion which is addressing the needs of the child. So when we talk about inclusion, we need to understand, is a particular school capable of inclusion? Do they have manpower for inclusion? Do they have a particular syllabus and a curriculum to cater the needs of the child with autism? So when we talk about inclusion, we need to definitely deliver all of this. So there's a lot of room to work on these areas before we talk about all children being included. And also understand that not all children can be included. It also depends upon their cognitive abilities, their level of communication, behavioral problems. So each child has different needs. So some of them will require special education, completely a specialized setup.
So as a parent, I should be always open to which suits my child better,
Yes.
rather than pushing
Yes.
for one.
Yes,
or the
because you
other.
can put the child, but the child is not benefiting. And sometimes behavioral problems worsen because of that.
And also, this could affect the self-esteem of the child.
Self-esteem of the child, yes, definitely. Because the child is, sometimes children, become more resistant,
Yes.
more stubborn, and they're scared to do anything else. They're that's the reason why a parent says, this child does not have confidence. He doesn't learn anything new. To learn anything new, he fears a lot. Why? Because the child is given a task which is above his expectation. So we need to take care of all of this. So building self-esteem, self-confidence is over a period of time. So a lot of parents may think, self-esteem and self-confidence, again, it's a bit different in children with the spectrum, but again, during the course of time. Right? So we are looking at how is the child resisting the task, is the child approaching the task, because sometimes there could be an information overload from the parent or from the therapist. You have to do this, you have to do this, whereas the child has not attained that. So that's when you get into task avoidance, resistance, stubbornness. So if you want to build confidence in the child, again, a stepwise approach. And like all children, definitely praise and appreciation. Sometimes we may forget some of these things as well.
Okay. Thank you, Doctor. And lastly, I would like to ask you, do you think residential options need to be considered for a...
See, residential options are definitely coming up. As you know, there are some in Hyderabad, some in Bangalore as well. It is a very difficult decision for parents to take, and especially I see this when the child is, when the boy is like 20, 22. It's a very difficult decision for parents to take, but in some cases it may be a good option, especially in scenarios where the boy or the girl, whoever the individual with autism, is highly aggressive, is unable to be maintained with parents. And parents are the primary targets of aggression, and we see these kind of cases where some amount of separation has to be done in such cases. So residential option is not a bad option, and it has to be considered in some cases, in some scenarios, but again, that should be a stepwise decision, and a lot of time should be given to the parents.
What about the age? Like, is there any age when you need to, like, like, for example, an age before which you shouldn't consider this would be...
See, in most cases, parents also consider, what I have seen, again I'm talking from as a clinician, most cases they have considered it only above 15 and above 16. In fact, above 18 a lot of parents, but the options are very few. Again, affordability, availability, accessibility. So there's a lot of work to do in this area. I've not come across any parent who's thinking of putting a 10-year-old or a 12-year-old. So that question hasn't popped up. Because most parents have waited so long for that.
So thank you, Doctor, for an enlightening session about autism.
Thank you, Chitra.
And thank you all for listening in to us, and please don't forget to subscribe to our channel. And if you're a parent who needs to reach out to a support group, the contact details will be mentioned below. Thank you.